Okay, I think we'll go ahead and get started. Hi, everybody. I hope you're all doing well today and you've enjoyed your last 2 days of the virtual junior medical school. Today, we're going to do a patient simulation. So we're going to start off with Kate and Mary. They're going to give you a quick presentation and teach you a couple things. And then we also have simulated patients who are going to be in your breakout rooms with you. So you'll get to meet them very soon. I want to give them a huge thanks for putting this together. I know it was a little difficult to figure out how we're going to get all of you students together and in breakout rooms and get to work with our simulated patients. So without further ado, Kate and Mary, take it away.
All right. Thank you so much, Haley. Good morning, everybody.
Hello.
I see some faces I know out there. It's nice to see some of you guys here. So my name is Mary Denmead and my cohort here today.
And my name is Kate Noonan.
Go ahead, Kate.
All right, we'll start off here. So we're going to start off with a couple expectations for today's session. So Mary, you can go ahead and advance the slide here. So just please be respectful of each other and of the simulated patients, of course. I'm sure that won't be a problem. We'd love for you all to be active participants. We'll keep you muted in this main room part, but we will ask you to participate via the chat box. And we also will have some polls that we want you to participate in. So mostly just to know that you're still awake, but also to get some input from you. And then when you move to the breakout rooms, we'll have you unmute so you can interact with each other and the simulated patients, okay? And then the last things, of course, we want you to have fun, ask questions. Again, use the chat box if you have questions, and hopefully you'll learn something today. All right. So next, we're going to go to who we are and what we do. Mary, you can take it away on this one.
Well, as I said, my name is Mary Denmead, and I am one of the coordinators of the Simulated Patient Program here at Carver College of Medicine. And before I became one of the coordinators, I was a simulated patient myself, and I came from an acting background. So this is usually what happens when I work with kids. Kind of scary, but my favorite job a part of this job right now is that I get to work with other simulated patients who are also sort of actors, but also communication teachers. So we have a good time here. Kate?
And as I said, my name is Kate. I've been working with the simulated patients here in this program for over 5 years, about 5.5 years now. And I also love interacting with simulated patients and being able to do these STEM programs. And I love tacos. It's a well-known fact. A lot of people, I really love tacos. So I feel like I have to share that with everyone. All right.
So what is a simulated patient? So simulated, you guys know what simulated means. It means not real, right? It's not a real actual patient. So our simulated patients here at the Carver College of Medicine pretend to be sick. They pretend to have some reason that they're going to go to the doctors. So when our medical students are learning all of these skills of interacting with patients, of finding out what's wrong with them, it's kind of good for them to practice on a real person instead of just kind of in their head or with a friend who's going to be a doctor too. It's kind of important that they learn how the things that they say affect the people that are coming to see them. So that's why we talk about a big part of our job is talking about communication skills. And that's what we are going to do with you guys today.
All right, so we're going to start by talking about the patient interview. So there's kind of 3 parts that we're really going to focus on today that you're going to have a chance to work on with the simulated patients. So that's on the next page or the next slide. Yeah, so it's going to be opening the interview. How do you even start talking to your patient? Establishing a chief complaint. We'll explain what that is in a second. And then also getting history of present illness. Again, we'll explain what that is, but basically these are the ways that you're gonna open up your interview, start talking to your patient and start figuring out what's wrong with them. So the first thing that we're gonna focus on is opening the interview. Mary, I think you're gonna do that one, right?
So opening the interview. So when you go into the doctor's office, if somebody just walks in the room and just starts looking in your teeth if you're at the dentist, or they just start, okay, lift your arm this way and let me take a look at that sore knee. it kind of is confusing, right, as a person. So we want our patients, our medical students to learn how to introduce themselves. Now, for some of us, that seems pretty easy. You just walk in, you say, hello, my name is Samantha, and I'm going to talk to you today. Well, that seems easy for some people, but for others, it's a little tricky. So we talk about introducing ourselves in a way that makes the patient feel comfortable. So first and foremost, hello, my name is Dr. So-and-so. So you guys can all, where you are right now, while your microphones are muted, say that out loud to yourself. Hello, my name is Dr. fill in the blank. I want to see your mouths moving. Excellent, good. So introducing yourself is important, and then also sort of making sure that you're talking to the right person. And can you tell me your name so that I confirm that I know who you are? So then we want to, before we just go right for what are you doing in the doctor's office today, we do something called build rapport. Everybody say that word out loud. Rapport. All right, so building rapport means kind of finding a way to make a connection with that person. And we have a fancy sort of definition for that. It's a friendly relationship or connection in which the people involved understand each other's feelings and communicate well. So that means you kind of just, what are some things that you might want to say to somebody to open a conversation with them? Well, you know, if you are making a new friend, you say, wow, you have a shirt on from the team that I really like too. That instantly makes a connection, right? Or look at you, you have braids, I have braids today, or fill in the blank. Should we do a little chat box, Kate, on this one? What are some ways that you might build rapport, or should we save that for later?
Let's do a poll.
Okay.
I'll pull up the poll real quick. I think that's the next slide.
All right, perfect.
Is poll. So I'm going to pull up this first poll. So we're going to launch a poll here. And the question is, which of these questions or statements would you use for rapport building? Do you think that you personally might use if you were trying to build some rapport or build a relationship with a patient? So I'm going to pop up this poll and go ahead and click on which one you think you would use. Ooh, they're coming in. Let's see.
Good, you guys.
Looks like we have a front runner here. See if we get a few more responses. Very good. We'll do 10 more seconds for somebody to pick out which statement or question that they would think they would use with a patient. All right, looks like we've got most people's responses in. So we're going to go ahead and end polling, and I'm going to share the results. Share the results with everybody. So our front runner is "What a beautiful day. Any plans for the afternoon?" Followed by "You look a little uncomfortable. Is there anything I can do to help you feel more comfortable?" After that is "Did you have any difficulty finding the clinic today?" And then "How about those Hawkeyes?" That was a tie there. And really what we wanted to get at with this poll is that any of those are ways to build rapport with a patient. It may just depend on the patient and the relationship that you're trying to build with them. So there is no right or wrong, but there's obviously things that people prefer or things that are more comfortable for them, a way that they think they might relate to a patient more. So it's obviously totally fine to say, "What a beautiful day, any plan for the afternoon?" It's also totally fine to say, "How about those Hawkeyes?" If you're a Hawkeye fan and you know your patient is too, perfectly fine. So there's lots of different ways to build rapport. It just depends on the people involved, right? So everybody's relationship and everybody's connection is a little bit different. So you might find different ways to build rapport or to create a connection with your patient. So good, awesome. Thank you for participating. I'm going to stop sharing the results there, and we're going to move on. So we've done open the interview so far. We're going to move on to the next part, which is establish chief complaint. So on the next slide, I think it tells us what a chief complaint is. Mary, oh, there it is. Yes, chief complaint is a statement describing the symptom, problem, or other reason for a medical encounter. So basically when the doctor says, what brings you into the office today? What brings you to the clinic? Or why are you calling in? They're establishing chief complaint. They're finding out the main reason you've decided, or the patient has decided to call into the doctor's office or come to the doctor's office today. So that's what you're gonna be establishing with your simulated patient today. You're going to be finding out why are they needing to talk to the doctor today. And we're going to do an example to help us get through the rest of the interview that we're going to be reviewing. So on the next slide, we're going to do a example of a chief complaint. I've got a terrible headache. So for the rest of this presentation, we're going to focus on headache being the chief complaint to kind of explain the last part of the interview that we're going to focus on. So headache is our chief complaint.
Oops, sorry.
Okay. That's, yeah, I'm done.
Okay. So if somebody says I have a headache, I have a terrible headache, is that enough information for you, do you think, to know how to treat this patient? Not really. We need to kind of, as we say, unpack the box that is the headache. So, so we have to kind of find out the history of the present illness, or the HPI. That's how we call it, how do we refer to it here. So the history of the present illness brings up a lot of different questions. So I'm going to have you guys go to your chat box. So this is where you're going to help me out here. So if you went into the doctor with a headache, what are some of the questions that, and if you were the doctor today, what are some of the questions you think you would ask your patient? So I'm going to have you open in the chat box and kind of list what, let's see, I'm going to get back to so I can see the chat. There it is. So go ahead and quote unquote shout them out in chat box, the kinds of things that you.
Good. Yeah. When did it start? Where does it hurt? How long has it been hurting? Can you describe it? Great.
Good, you guys.
Have you had the headache? How do you think it happened? Fabulous. These are great answers, guys. Good. Any other symptoms? Any other, yep, light sensitivity. Great. Wow, look at all these things coming in. Are you guys doctors already? When did it start? Can you describe the pain? I think we talked, yeah, fabulous.
Great, wonderful. Well, you've done it. You're well on your way. So we're going to kind of borrow from some of your ideas that you wrote in the chat box to sort of show you those are all perfect answers. And sometimes all that information coming in needs to be organized in a special way. So we teach our medical students to kind of have a little kind of an acronym, like a word that describes other words. So the big one that we like to work with is a word called old carts. See that down there in the bottom left of your screen? The HPI, the history of the present illness, involves the old carts, which are some of the things we're going to talk about, and also these IC questions, which is another sort of abbreviation that helps us remember the questions that we want to ask. So old carts, let's take a look at what you guys put in the chat box, because old carts describes what you just wrote. So what did you guys put in the chat? Kate, I cannot see the chat. So if you see anywhere that somebody said, did O fit into one of those?
It did, yeah. Okay. So we have, somebody put, when did it start? So O stands for onset, which is exactly that. When did it start?
Excellent. And how about the next one, L?
So L, does anybody have a guess on what they think L stands for in old carts? I see a question in here that matches the L. Ah, location, yes.
Excellent.
So L, location, where does it hurt? Where do you feel the headache? Good.
Next one is D. So what do you think D stands for? Did that show up anywhere in there?
I do see some, aha, yes, I see some duration. There you go, good.
All right, somebody wrote in duration. Good for you guys.
How long does the headache last? Fabulous.
Excellent. Next one, C.
Yeah, character. What question do you think character refers to, or what would be the question that you would ask if you were trying to get at the character of a headache? What is it like? Yep, good. What kind of pain? How does it feel? Perfect, fabulous. Yeah, those are all different ways to ask someone to describe the character. What does it feel like? So for that one, we're getting at things like, what kind of pain? Is it a sharp pain, a dull pain, throbbing? Yep, good, fabulous. Next one. This one's tricky. There's a couple answers for A.
So when we go to the doctor, we usually have tried something first, right? We kind of think we've done something in advance to try and make it feel a little better, right? Before we rush into the doctor, right? So we ask questions like, did you do anything to make it go away? The doctor will ask, do you do anything that actually makes it any worse? So alleviating or aggravating. Did we have anything in there from
Yep.
that? Good.
Anything
Awesome.
make the pain better or worse? Good.
Excellent.
And you may ask both. You may ask only one of those. Sometimes it depends on what information you're getting from your patient. Let's try R.
This one's tricky too, because you don't always think about this. We think, I have a headache, but sometimes that headache shows up in different places in our bodies, right?
Yeah, I'm seeing radiation. There we go. I was going to say, what question do you think you would ask about radiation or radiating? That's kind of a tough one.
Yeah. Do you feel the pain anywhere else?
Anywhere else. So sometimes if you have a headache up here, maybe it spreads down the side. So really the headache's on the top of your head, but you also feel some pain that radiates or moves down through the side of your neck or something like that. They want to find out if you're experiencing pain elsewhere. Yeah, good. T? Yeah, so I see a lot of timing coming in. What question do you think you would ask to figure out timing? It's a tricky one. Oh, there we go. Yeah, so when did it start, remember, is our onset question. So you're finding out at the beginning, when did you first experience a headache? And timing is a little tricky. I do see questions in here. Does it happen at a certain time? Or do you notice that it's always in the morning when you get up, or afternoon, or at evening time, or after you eat lunch? Whatever it could be, there might be something related. So is there some sort of schedule, or is it something that just is there all the time every day? Yeah, good, great.
Our last one is S.
Ooh, solution. That's a good guess.
Ooh, interesting.
Not solution, but.
So if you go into the doctor with a little headache, it's just kind of little teeny there, and it doesn't really bother you very much. It's not very.
Yes, severe.
Severe, good for you.
Severe, and I did see some people early on write on a scale of 1 to 10.
Excellent.
So yes, so sometimes your doctor may have you do if there's someone is in pain, they may do a pain scale and say on a scale of 1 to 10, 1 being really no pain at all and 10 being the most pain you've ever had in your life, how would you rate this headache? Or maybe they'll just say, how bad is it? And maybe how bad it is I can't get out of bed. That's how bad it is. So sometimes it depends on the information, again, that what you're looking for. But yes, how much it hurts, and the pain scale is part of that severity question. Good, great.
So those are our kind of main questions, and that's one question at a time, right? Onset, location, duration, character, aggravating, radiation, timing, and severity. That's a lot of individual questions to ask, right? So sometimes we want our patient to do the work for us, but I guess we'll
do our ICEE questions.
We'll do the ICE questions first.
Yeah.
So the next set of questions, ICEE, are questions, and we can kind of breeze through these a little bit, but these are the questions that really help make a connection. So this is, the ICE questions are really a part of rapport building also. So I saw somebody in the chat box said, what do you think is wrong with you?
Yes.
So every one of us knows our body better than anybody else, right? So we might have an idea of what caused this horrible headache. So that's what I stands for, ideas. What do you think may have caused your headache? So good for you guys for asking that question earlier. And then the C stands for, now I might walk into that doctor's office today telling you that I have this terrible headache, but what really concerns me is that I can't get to work today. I'm really worried that I'm going to lose a lot of money if I don't get into work and finish my job today. So that may be more important to me, the patient, than talking about my headache. So this C stands for concern. What are you most concerned about? Well, I'm concerned I'm going to lose my eyesight. I'm concerned that my hat isn't going to fit anymore if my head is throbbing as much. I don't know, something like that. So you don't know what is most important to your patient until you ask them. And as soon as you ask that patient what's most important to them, that makes them trust you. That makes a really wonderful connection of one person to another person, which is the whole purpose of what we're doing as doctors, right? Making people feel better. All right, E.
The last two are E and E. So the first one is effects, and that is really just asking how is this particular pain or problem affecting your daily activities, or how has that changed what you're able to do from day to day. So like I mentioned earlier, if the pain is so severe in my head that I can't get out of bed, then that's really affecting my daily activities. I'm not able to go to work or read if I like reading, or maybe I can't get my house clean or pick up my kids from school, whatever the issue might be. So it's really how it can kind of relate to the severity as well, but it's a different question. But it's really how it's affecting your daily life. Yeah. And then the last E is expectations. And for that one, it is really finding out from your patient what they expect from today's visit at the doctor's office. What can I, as your doctor or healthcare provider, do for you today? What are you hoping to get out of today's visit? And maybe it's something like, I just want some medication or a recommendation to get this headache to go away. Or I want you to sit down and talk with someone about this so that I feel better, whatever the expectation might be. So finding out how you can best help your patient by understanding what they expect from you. So again, those are your
ideas, concerns, effects, and expectations. A nice little tool. We call these tools that we put in our little doctor bag. And when we walk into the door, we know that these are some of the ways that we can get our patient to open up to us. Now, let's think about one last thing before we're going to throw you into the interview with your patients. So, Kate, you want to take this one? You want to start?
Sure, I will take this one.
Great.
So we went over a lot of things of the types of information that you want to get from your patient. But as we've kind of hinted at, what we really like to focus on with simulated patient is those communication skills. So it's not just what information you're getting, it's how you get that information and how you interact with your patient. And a big way to communicate better with them is using a combination of open and closed questions. So for example, on the next slide, if we were to talk about Marvel movies, an open-ended question or examples of open-ended questions for Marvel movies, go ahead and next slide here. So asking, what Marvel movies do you like? Tell me about them. So it's very open, meaning that the person you're asking has a lot of freedom to give you a response. They can tell you all about whatever their favorite parts are, whatever their favorite movie is, who their favorite characters are, whatever they choose to tell you, they get to tell you their story, which is what we want to try to get our patients to do at the very beginning. But sometimes you also, as the healthcare provider, know that there's specific information that you also need to get from your patient that maybe they didn't cover in their initial explanation of what's going on. And then you move to things like closed questions. So examples of those would be, do you like Avengers Endgame? Is Thor your favorite character? So those tend to be one-word answers. A lot of times they're yes or no type answers. So you're getting really one piece of information with that question. So moving on the next slide, I'll kind of put that in context with the headache. Starting at the top, getting a lot of information from your patient saying, what can you tell me about the headache you've been having? Tell me everything about it. And then you may realize they told me a lot, but they never told me where the headache is. So now I'm going to say, where is the headache located, which is kind of a medium in between open and closed question. And then you really might need them to be even more specific and say, do you feel the headache on the side of your head? Yes or no. So you do need to use a combination of all of those questions, but you sort of move from broader to more specific. So that way you can kind of narrow down the information that you need. So that's one of the skills that we like to just work on. So just thinking about those when you're in the room, don't worry about it too much, but just one of those communication skills that we like to work on with our students. And then the very last thing that we just want you to be thinking about as you're in the room talking with your patient is just think about, if you were a patient, how would you like to be treated by your healthcare provider, right? Do you think you'd be more likely to share information with someone who's really grumpy and ask you one word answer questions? Do you have this? Do you have this? Does it feel like this? I feel like a checklist. Probably not.
Probably not. You probably want you want them to see you as the person that you are, and you want somebody who's listening to you and getting you to do more of the talking instead of the doctor doing most of the talking. So those are a lot of things to think about. Opening the interview, building some rapport, establishing a chief complaint, and then getting some information from that patient, letting the patient do that work. So I think it's time, right? Is it time?
Yeah. Yeah.
All right. Drum roll, please.
So we're going to send you into breakout rooms with a patient. We'd love for you to practice all three of those parts that we covered. If everybody could practice introducing themselves and maybe picking out a rapport building statement, it could be one that you put in the chat box. It could be one that you saw on the poll, or one that you make up off the top of your head. We want everybody to try to practice those things and then work together as a small group to see if you can cover all those old carts questions and find out all the details about the patient who is in pain today. You'll establish the chief complaint when you get in the room as well. So make sure you ask them why they're calling in or at the doctor's office today, and practice each of those things, okay? So we can have our patients reveal themselves just so we know everybody's on camera. And then once you get into your breakout rooms, you can unmute yourselves as well. And you'll have about 15 to 20 minutes in the breakout room with your patient, okay? We'll let you know when you have a little bit of time. We're gonna close the breakout rooms.
Right.
All right. Ready?
Ready.
Good luck.
Okay, welcome back, everybody. How did practice go? Thumbs up? Yeah? Good? Great.
Well, you asked a lot of different questions in there, I'm sure, to find out what was wrong with your patient. And that doesn't end there, right? So in the next parts of the interview involves, sometimes we have to do a physical exam, which we obviously are not going to do today. But maybe we could kind of use our chat box, right, Kate? To think of some other questions that, and you guys already did this earlier in the day. You showed some initiative and asked some of these second part questions, but what are some of the other things that you think you might still need to know beyond this history of the present illness? What are some other things?
Yeah, MRI the patient's knee. So that would be one of the maybe physical exam portions of it. Yeah, looking at the knee. And again, we did see some of the questions that you asked earlier when you were coming up with the types of things you would ask about the headache example would be some of the things that you would ask that kind of go beyond the history of present illness. Good.
What do you do after you know what's wrong? Ooh, that's a really good question.
Yeah.
Yeah, so finding out, so that's an important part of the interview too, is giving the patient some information of like, well, these are the things that I'm thinking, and I might want to do this test and that test, or offer you this medication or this therapy that would make your knee feel better. Some other things, earlier in the day, you asked some questions that were, does anybody in your family have anything like this? Why would you ask, why do you think you'd ask about family? Why is that important? You can answer that in the chat. What do you think asking about somebody's family? Hereditary disease,
Yeah.
excellent, yep. So genetics, some things are passed on from parents to kids, but as you guys know that too, good, excellent. So family history is really important, some sort of things, some genetic things that might be passed on. And another thing, what are some other things? Let's see. For prior injuries, good,
Yeah.
somebody mentioned that too. So if this knee pain happens every spring, it might be something that we need to look in a little deeper into, right? So good. So family questions, past family history, past medical history, your own personal medical history, past medical history, your family's medical history, social history. What is social history? Who knows, who has any idea what a social history might be and why it might be important to find out what's wrong with this person? Well, maybe who you met, somebody it might be you got it from somebody else. Good, excellent, right. So the people that you know in your life. So who do you live with? Where do you work? What kinds of things do you do? Good. Have you been out of the country?
Good.
Good, excellent, all excellent questions. So getting a big, because this person is not just this little tiny knee pain that they have today, this person is a whole person. So finding about their history, their past medical history, their family history, the things that they do and how they live in the world, and maybe social history also involves, do they smoke? Because smoking affects your physical health in a huge way, or other sort of habits that you might have that that can affect you in a good way or a bad way. Do you eat a lot of fried foods?
Exercise, how much
exercise?
people are exercising, good. Some of those lifestyle things, yeah, that might give you an idea of what's going on too. Very good.
Right, excellent. And talking about closing the interview, the last part of it is kind of what we mentioned before. So like somebody had asked that question, what do you do after you find out what's wrong? Well, we can't solve it necessarily in one doctor visit, so we might need to do some further tests. So letting your patient know what's next. And when you let your patient know what's next, then they feel confident that you are the person that is going to help them get to the other side of this difficult time for them. So good, you guys, excellent, really good. All right. Yes, I see you added that about how much junk food and all right, so we are not going to necessarily have time for more practice, but we do have time for another poll.
One more poll. So this is all about what your kind of main takeaway or the main thing that you have learned from today's session. We only give you 4 options, unfortunately, so you have to pick one of those, but you're also welcome to share other takeaways or other things, a really important thing that you learned. If you want to share something like that in the chat box, you can do that as well. But I'm going to open up this poll and we'll see what your biggest takeaway from today's session is. So I'm going to launch that poll for you. Good, it looks like we've got most people in. We'll give you about 15 more seconds to pick out your biggest takeaway. I wish doctors had interrogation rooms like at police stations so that you could watch or you could see what types of questions they ask. That's funny. All right, I'm going to go ahead and end the polling and we'll go ahead and share the results. It looks like the biggest takeaway for most people are what questions do you ask to find out what's wrong? So using those old carts, that acronym and figuring out what each of those stand for, and thinking sometimes you don't have to ask all of those. You may not need all of that information, but it's sort of all the tools that you have in your toolbox when you're interviewing. And then the next one was that it's remember to treat the patient like a person. So you're having a conversation with the person, right? They're not just a checklist of symptoms. They are a person, and interacting with them should feel more like a conversation. And then really close, Thor is the best Marvel character. I'm glad a couple of you got that as your takeaway for today. And the difference between open and closed questions.
Great. Well, you guys, this has been a lot of fun for us today to meet with you and be a part of your mini med school today. And if our simulated patients are still here, we'll ask that they they go ahead and reveal themselves.
Dr. Strange is cool too, I understand.
And we want to thank our patients so much for joining us today. We want to thank you guys for being here. And it looks like you have a quiz to take at the end of this activity, so Haley will tell you more about that. But I think that's it from us. Was there a question, Haley? Was there anything that we needed to answer?
I don't think so, unless you saw one in the chat.
I just see a couple other great takeaways from today. If you don't respect the person, they will just answer the question and not really tell you anything more. So yeah, if you're not treating your patient like a person, they may not feel comfortable sharing very much information with you, and it's going to make that interview a lot harder, right? So good.
All right.
You need to be good at art. I don't think you need to be good at art.
No, not necessarily.
Not necessarily. All right. Well, again, thank you so much for joining us today. We hope that you learned a few takeaways from this and enjoyed the experience of being able to interview a patient. So thank you, everybody.
Yes, thank you so much.
Bye.
You guys can go ahead and leave the meeting whenever you're ready. And then don't forget to take your quiz on the website when you're done. We'll see you tomorrow, 10 o'clock a.m., same time. The link for the meeting tomorrow is also on the website, but we will send it in an email as well in the morning. So let us know if you have any questions.